Hey guys, so today we're going to talk a little bit about blepharoplasty. So that's a term that many patients don't understand. And so what is blepharoplasty? Well, blepharoplasty is eyelid surgery. So very often we're talking about the upper eyelids or the lower eyelids. Patients will often think about this as an eyelid lift. This is one of the most dramatic or powerful plastic surgeries that we perform on the face. So when patients, anyone interacts with one another, they really look at each other in the eye, right? So if you change the frame of the eye, it can powerfully change the appearance. And so very often, as a patient gets to be a little older, they will often have a little excess skin in the upper eyelid. Sometimes they'll have excess fat. Sometimes they actually won't have enough fat. But this can give the appearance of aging. And so very often we'll remove skin from the upper eyelid. Often we'll remove fat. Sometimes we'll reposition the fat or actually add fat depending on what the patient's condition is. So it's very important that the patient comes in and has a consultation so that you can really describe to them exactly what you need to do, to improve the appearance of their actual eyelid. Many patients often ask, well, where is the incision? Am I going to have a big scar on my face? Well, almost always we hide the incision in the upper eyelid crease. We call this the supratarsal crease. And so you have a tiny wrinkle there anyways, and so of course the incision is going to be red for several months. You're always going to have some bruising, you're always going to have some swelling, but in the end, that incision should be nearly imperceptible. Often patients of Asian ethnicity won't have that crease there, and they actually come in, and the purpose of their operation is to create a westernized crease. In regards to the lower eyelid, so often patients will have too much skin or excess bulging of the fat there. So very often we'll remove fat or remove skin or reposition the fat, just depending on what the deformity is for that particular patient. Sometimes we can hide the incision on the inside of the eyelid, which is nice because the patient doesn't have a visible scar at all. Sometimes we'll hide the incision along the lower eyelash line. Occasionally, if the patient has a really large bag or festoon, we'll actually need to hide or camouflage that incision along what we call the tear trough area. But almost always these incisions heal almost imperceptible, and it really can dramatically change the eyelid appearance, both upper and lower, and really frame the eye in a more positive way to give that appearance of youth. I think it's important though that each patient's operation is individualized. There are many patients that come in that don't actually need an eyelid surgery, so maybe they have darkness or bags or have a few wrinkles that can be treated with some type of topical product, some type of resurfacing, or maybe even a non-surgical injection like Botox or fillers. And so many patients are often very happy to hear that they don't actually need an operation to fix the problem that they came in for. And this is, more and more common nowadays. I mean, if you look at the percentages of patients that come in, they get an operation, it's typically, somewhere between 8 to 10 and 1 will get some type of non-surgical procedure for every one that gets an operation. I think it's also very important to individualize the patient's care based on the full face. So you don't want something to be out of harmony with the rest of the face. So you need to decide, is what we're going to do around the eyes going to make the rest of the face look unnatural. Another thing is that often the brow position is the problem for the patient. So they may not have extra skin or fat in the upper eyelid. It may just be that the brow needs to be slightly raised. So if you actually remove skin from the upper eyelid, it can actually pull the brow down even farther. So you really need to have a skilled facial plastic surgeon, oculoplastic surgeon, general plastic surgeon, or dermatologist really examine you in particular and make sure that you're getting the right procedure performed. So if you have any questions about this, please let us know. It's one of our favorite things and really can make some dramatic transformations for patients. So thanks so much.